Hi, Dr. Rebecca Brown here from Brown Chiropractic with your Friday favorite. And this week I'm super excited to have with me Colleen Tetzlaff who has moved in right next door. She is a nurse practitioner and she has been bringing together conventional Western medicine and holistic treatment since the early 1990s. She has some fascinating ways to work with patients that I want to talk to you about. And just to tell you a little bit about her before we get into that, she earned her nursing degree from the University of Maine in 1990. Same year I earned my chiropractic degree. It was a good year.
Yeah.
And then she got her master in nursing in 1997 and doctor of nursing in 2012. So she's been in the area for years, but she just came to Yarmouth, right next door to our building here at Harborside Family Practice in March, and she's going to be moving the health clinic she owns in Portland right into the same building next door on November 1st. Integrative therapies for prevention, cancer, and chronic disease. So sometimes I like to look at what patients say about practitioners will often tell me the most. So I want to read to you a few things that I read from comments online about her. The most common adjectives that I saw were actually professional, caring, thoughtful, and thorough. Colleen, as someone wrote, Colleen has been a lifesaver for me and my family. Natural and holistic treatment approaches are integrated into a well-rounded modern practice, able to assimilate lots of data and pull together important items. Very knowledgeable and able to relate the information in a clear, concise way for me to understand. She spent time with me, was not rushed. And this is my favorite. Colleen is superb in every way. Lot to live up to now.
Yeah.
So,
Kind.
can we start by maybe explaining to patients the difference between alternative and integrative?
Sure. So I practice integratively. I don't practice alternatively, meaning that I will bring together the allopathic approach that you may be used to in what we call Western medicine, or at most of the healthcare that is around in large group organizations. I will bring to that strategies, modalities, and suggestions to augment your care, to look at the roots of your problem. My toolbox is bigger, so I'm going to bring potentially herbal nutritional medicine to help you with whatever's going on, and also for prevention, not just for problems, but in terms of aging well, what types of things may be important to aging well. So it is really bringing things together. It's not negating that there are obviously things from allopathic or traditional Western medicine that are helpful and important. It's bringing other things to the plan and to the workup too, because the workup can be a little different, in terms of standard lab tests people might have done to look at something. I may look a little deeper, a little larger lens. As I was saying to Rebecca, the lens is a little bigger. So sometimes we'll be using some other testing or looking at some other things and spending the time to understand the underpinnings of what's going on. Even with prevention, spending more time to look at lifestyle and doing a lot of counseling and coaching, but never negating the allopathic approach, but really trying to, as I say, I try to minimize the use of pharmaceuticals. I don't necessarily say that I'm never going to use them or they're not appropriate for my patients, because they can be.
Yeah, I see a lot of patients come in here and they have these chronic problems of GI symptoms, fatigue, even autoimmune things, and they have had all the testing, I've been to the doctor, nothing's wrong,
Right.
and yet I'm so uncomfortable, I'm exhausted all the time. What would you do you started to elaborate on that a little bit, but what would you do that's different from what their medical doctor has already done for them?
Yeah, I think that spending the time with people really helps for you to start to connect the dots. And then I look at systems, so I'm looking at endocrine, nervous, and immune system function, and trying to piece together where in those systems have something gotten out of balance. I will do taking the time and the history of connecting those dots, and then deciding what beyond what has already been done to look at this issue do we need to look at with maybe a little bit more of a intensive set of lab tests or other types of tests that can help us to understand what is going on with this person. But it does take time, and sometimes there are additional tests that we want to run beyond what has already been looked at. Because in Western medicine, there is a standard of care, and so you go in with a problem, there's a standard set of lab tests that may be run. I'm going to expand upon that and look at some other things, whether they be nutritional deficiencies or even subtle imbalances in people's hormones, their neurotransmitters, both in the endocrine system with the thyroid, with the adrenal glands, and the sort of like idea of a functional issue where maybe it's not showing up on lab tests, but perhaps it's underperforming in your body. It's out of balance, and those don't always show up readily on standard testing. So we have to tweak that out. We may run more tests, but then in the end, kind of look at. I even use forms that help me to look at neurotransmitters from the answers to the questions that help me to understand maybe what is imbalanced in the body.
Yeah, great. And tell people a little about your licensing. Do they need a referral to see you, or can they call up and just come right in and see you, even though they have a different PCP?
Yeah.
Can you be their PCP? How does that work?
I can be a PCP. In the state of Maine, nurse practitioners are allowed to be primary care, and the bulk of my private practice is primary care. I'm a primary care provider to most of my patients. But I also do specialty care. I will do integrative cancer consults. I will do integrative gastrointestinal or other issues. Autoimmune is a good example of one that I would do as more of a consultation. If they're not my primary care provider, they can certainly call and see me. The only reason they would need a referral is if they have an HMO, which requires a referral to see a provider. And they need to get that from their primary care. So I do see some patients who are not my primary care patients, and I see them for the expertise I bring to their integrative functional medicine care, but they have a different PCP. And I take insurance. I take, including Medicare, I do not take main care. I do bill insurance. In my private practice, I have a small concierge fee that I charge monthly or yearly to also be in my practice. So the only time a referral would be necessary is when you have an HMO insurance.
So I know one of your specialties is helping people, patients with cancer, and so tell me a little bit about your approach.
Okay.
For that.
Yeah, I'm definitely not an alternative cancer provider, meaning I'm not working as alternatively to what an oncologist might recommend to you. I'm trying to bring in some other strategies, modalities to deal with either the cancer itself or the side effects from the treatment to support patients and work more as a appropriate integration. So not everything is necessarily appropriate. It can be a lot to sort through what is out there and people have access to on the internet for dealing with cancer and certainly other conditions. So I try to bring a science-based approach to that, of what might be the most helpful or what might be the most supportive, or what they can do to support themselves through that journey, through treatments. And then beyond, I do a lot of work with reducing risk of recurrence and some things that you can do there to, over time, reduce your risk of cancer recurrence or other cancers.
Great. And I know some people are afraid to be going places or seeing practitioners right now, especially people who might be very sick with cancer or autoimmune diseases. What's changed for you in COVID times, or how are you doing things differently that might make people feel safer to work with you?
I mean, we have a very small office. We don't use a waiting room right now. We have our patients check in and go immediately to their own waiting area, which is their own room. and then I'm the only person other than my administrative assistant who's bringing them into the room. I don't use a medical assistant. I'm the person who's visiting with them. We use masks. We are distancing when we're talking, but it's a very low risk practice in that it's small.
Yeah, great.
Yeah.
And tell me, so I know you're in some transition, you've got a practice in Portland, it's moving November 1st to right next door here, but what's the best way for people to get in touch with you right now? Would it be
Well, my office phone, we're certainly scheduling beyond November where we'll see people over here, but to call my assistant Carol at 699-3838, that's our office phone, and that won't change. Certainly we can, that information will all stay the same as we transition over here after November.
Yeah, great. Well, I'm super excited to have you moving in next door. I've had quite a number of patients of ours have seen Colleen over the years and said nothing but great things about you. So when I heard you were moving next door, I said, oh, I got to get you in here and chat with you. So very exciting. If you're looking for something to, widen your toolbox, as Colleen says, with some of the, conventional treatments you may be getting, but you're looking for something a little bit more. What more can you do for your whole health? You can't go wrong with Colleen. So check out her website and check out more about it. And thanks for listening. We'll see you next week.
Thank you.
Yeah.